No more panic attacks. A panic attack is a sudden, intense feeling of fear that occurs without real danger or obvious triggers, and can cause a severe physical reaction. Panic attacks can be frightening. When they occur, you may feel like you are losing control, having a heart attack, or even dying. Many people only have 1 or 2 panic attacks in their lifetime, and then they go away as the stress subsides. But if you have repeated, unexpected panic attacks and are constantly afraid of the next one, you may have panic disorder. Although panic attacks themselves are not life-threatening, they are frightening and can significantly affect your quality of life. They can be very effective with treatment. Panic attacks usually start suddenly and without warning. Panic attacks usually start suddenly and without warning. You may have panic attacks occasionally or they may happen frequently. There are many different types of panic attacks, but symptoms usually peak within a few minutes. After a panic attack subsides, you may feel tired and exhausted. Panic attacks often include some of the following signs or symptoms: feelings of impending doom or danger, fear of losing control or dying, fast, pounding heartbeat, sweating, shaking or trembling, shortness of breath or throat tightness, chills, hot flashes, nausea, abdominal cramps, chest pain, headaches, dizziness, lightheadedness, and fainting, numbness or tingling, feelings of unreality or apathy. One of the worst things about having a panic attack is the intense fear that it will happen again. You may be so afraid of having a panic attack that you try to avoid certain situations where they might happen. Risk factors. Panic disorder symptoms often begin in the teens or early adulthood and affect women more than men. Factors that may increase your risk of developing panic attacks or panic disorder include a family history of panic attacks or panic disorder, major life stressors, such as the death of a loved one or a serious illness, traumatic events, such as sexual assault or a serious accident, major life changes, such as divorce or having a child, smoking or excessive caffeine intake, a history of childhood physical or sexual abuse. If left untreated, panic attacks and panic disorder can affect nearly every area of your life. You may be so afraid of having more panic attacks that you live in constant fear, destroying your quality of life. For some people, panic disorder may include agoraphobia, in which you avoid places or situations that make you anxious because you fear you won't be able to escape or get help if you have a panic attack. You may also become dependent on others and have to have someone with you when you leave home.